Most people brush their teeth wrong, and the fix isn't toothpaste. It's 2 kitchen ingredients, but only if you avoid one dangerous mistake almost everyone makes. Sounds too good to be true? Stick with me. There's one surprising safety detail most people miss that can make or break the results. Welcome to BioMind Zone. I'm here to turn simple science into powerful daily habits. Today, an easy, evidence-rooted, natural approach to whitening, reducing plaque, and improving gum health using coconut oil, baking soda, and a practice called oil pulling. I've recommended variations of this to my family, friends for years, and now to my followers. With consistent, careful use, it's safe, effective, and inexpensive. But we do it the right way. Science first. No clickbait. I'll show the exact recipe, how often to use it, and the one big mistake that makes people damage their enamel, so you don't repeat it. Coconut oil's star ingredient is lauric acid, a fatty acid with real antimicrobial action. Research shows lauric acid can reduce levels of harmful oral bacteria like Streptococcus mutans, a major driver of plaque and cavities. But coconut oil does more than kill germs. It supports a balanced oral microbiome, so helpful bacteria survive while the bad actors are reduced. It also soothes inflamed gums by keeping tissues moisturized, a subtle protective effect many commercial products can't replicate. And while coconut oil calms and protects, what actually removes the stains is the other kitchen ingredient coming up next. Baking soda sodium bicarbonate is a mild abrasive, effective at lifting surface stains without shredding enamel when used carefully. More importantly, it's alkaline, so it neutralizes acids produced by bacteria in acidic foods. That protects enamel from demineralization, lowers sensitivity risk, and helps maintain a healthier pH in your mouth. It also stimulates saliva, which mechanically washes away food particles and bacteria. Remember that safety detail I promised? It's about frequency and technique, how often and how hard you brush with baking soda, because used incorrectly, even mild abrasives can cause damage. And no, baking soda alone is not safe to use daily. But combined with coconut oil and used sparingly, it's a completely different story. I'll explain the safe routine in a minute. Here's the exact safe recipe I use and recommend. 1 tablespoon coconut oil, virgin, unrefined. 1 tablespoon baking soda. Mix until you have a smooth paste. Optional, add 1 drop of peppermint essential oil for freshness and mild extra antimicrobial effect. Important, only a single drop. Essential oils are potent. Use a pea-sized amount on a soft bristled brush. Brush gently for 1-2 minutes, small circular motions, light pressure, rinse well. Do not brush hard or use this daily. Overuse or aggressive scrubbing with any abrasive, even baking soda, can wear enamel. Aim for 1-2 times per week and watch for sensitivity. If sensitivity begins, stop and consult your dentist. Oil pulling is an ancient Ayurvedic technique that complements the paste. After waking or before brushing, take 1 tablespoon of coconut oil and gently swish it in your mouth for 2 to 10 minutes. The oil's viscosity traps bacteria and loosens plaque and gaps and along the gum line where brushes miss. Spit into a trash can, not the sink. Oil can clog pipes. Then rinse and brush. Many people report fresher breath and reduced plaque after a few weeks of consistent oil pulling. Practical pacing. Start with 2 minutes if 10 feels long. Build up to 10. Quick plan you can follow. DIY paste. 1-2 times per week. Oil pulling. 3-4 times per week or daily if you prefer shorter sessions. Start with 10 minutes. Daily oral care. Continue using your fluoride toothpaste on other days. This natural combo complements, not replaces, regular dental care and professional checkups. Watch for sensitivity and stop if enamel wear is suspected. When in doubt, ask your dentist. One last pro tip most people miss. It makes the difference between short-term brightness and lasting dental health. Don't skip this. To recap, coconut oil fights harmful bacteria and soothes gums. Baking soda lifts stains and neutralizes acids. Oil pulling loosens plaque and reaches places brushes can't. Together they reduce plaque formation, freshen breath, brighten surface stains, support a balanced oral microbiome. Use this combo mindfully. Moderation and technique are everything. Replace hype with consistency. A weekly natural paste and regular oil pulling will do far more for oral health than sporadic intense attempts. Remember the counterintuitive part? The real secret isn't a magic ingredient. It's how gently and how often you use these methods. That's what preserves enamel and turns short-term gains into long-term health. If you try this routine, tell me what you notice in the first 2 weeks. I read every comment. Share this video with someone who wants a natural, science-backed approach to oral care. And if you're new here, welcome to the BioMind Zone community. Hit subscribe for more small, evidence-based habits that improve how you look and how you feel. Keep it gentle, keep it steady, keep smiling, and feel better.